Of course, we want to turn to the experts when it comes to the latest information about COVID-19 here in Kentucky.
Earlier today, I sat down with Dr. Craig Humbaugh, the Lexington-Fayette County Health Commissioner, to ask him about what we're learning. What you've seen over a week or so, give or take a few days, is this what you expected to see?
Well, we're in new territory, and but as we talked about, we expected to potentially see cases, but I think certainly the situation has evolved very rapidly, and we said that we expected that that would probably be the case as we saw, new cases popping up in other countries and starting to spread around the world, and we knew that at some point it would come to Central Kentucky, and it has.
Are we learning more about the actual virus?
Well, I think it's more clear about who's being affected most severely, and that seems to certainly be folks who are seniors and those who have chronic illnesses, and that seems to be confirmed as we see more cases worldwide. So yes, we are learning as we go, and but we still don't know everything that we would hope to know.
Once someone has been diagnosed with having COVID-19, and do we know yet about how long it's going to stay in their system, how long they're going to have those symptoms?
We don't, and I think that's going to be dependent on the person, because it appears that 80% of cases will be able to be managed at home and won't require attention of a medical professional. And we would expect that those cases may not last as long as more severe cases will.
And we're hearing stories of people who, on their own free will, they know that they may have been exposed to someone or something that could have made them susceptible, and they are on their own free will, quarantined in their homes. Do you still recommend that for anyone who thinks, hey, maybe there's a shot?
Well, our main recommendation is if you're sick, stay home. And stay home if you feel like you can manage it home if you normally would, even if the coronavirus wasn't a concern or a worry. Take Tylenol, take ibuprofen, drink lots of fluids, chicken soup, and if you're not getting better, then we want you to contact your healthcare provider by phone or by a telemedicine system that you may have access to. So a lot of insurance plans now do offer that, and that's a great way to be able to contact them without physically going into the office and potentially exposing other people to whatever your respiratory illness is, be it the flu or some other type of virus. There could be people who have relatively mild symptoms, and they could be spreading it to others who are at higher risk of severe illness. So, and that's one of the reasons for these new measures of social distancing, that we'd like people to try to distance themselves physically. When we say social distancing, we really, probably the term should be physical distancing. So to stay apart from each other, to stay home as a family, for instance, to avoid large crowds and gatherings. We're especially recommend that for the people who are at highest risk for severe illness that we just talked about. But as you said, people who are not could be spreaders, so we want to try to minimize their activity as well.
Coming up in our next half hour, Dr. Humbaugh speaks about the decision by school districts to cancel classes and officials to cancel public gatherings.